It's just so greatly appreciated and valued. And again, to have you here today to give us an update and share your thoughts and talk about the current status of Brown County is just really wonderful. So thank you for your time, and I'll just turn it over to you.
Thanks, Lori. And some of you heard me throughout the day on a couple other meetings, so I apologize about the repetition. I really would love to make this, an opportunity for the community, especially the business community, to ask me questions. So please use the chat function, and you'll see my head kind of bopping up and down because that's how my screen is. So I've got to look up from the camera to see your question. I message, I see some familiar faces up there today. I figured they couldn't get enough of me, or they're just there to stare me down, right, Mr. Marcus? I have you like right in front. So just to get started, I thought I would, a lot has changed. In 6 weeks, our learning with the novel coronavirus changes. So has, things as recommendations go nationally and locally and statewide. What I thought I would do is just kind of kick off and talk about the governor's plan, how it relates to the state, how it relates to Brown County, talk about some of the situations going on in Brown County, because I think that's, created some concern as you try to match it up with the governor's plan. But throughout that whole time, I would love to answer your questions too. And I can pause and keep going. I'll grab a bottle of water here every so often. It's been a long day of talking. I got a little bit more to do. And then, but like I said, at any point, please ask your questions, especially, those that deal with your individual businesses. So to kick things off, yesterday, the governor, initially last week, we found out that the April 24th date was being extended to May 26th. And a lot of people ask me, what'd you think about that? And I said, I just kind of want to understand the why. When you look at a date being out there, there's data behind it. And I understand they were looking at the rate of cases, but it didn't really come with, a plan or what do you do when you hit that date? So, personally, I understood a little bit behind the numbers that led to that, but not really the whole plan. And I think the governor and the secretary really did realize that, especially after the federal rollout, the CDC and the task force, led by Dr. Fauci and Dr. Birx and other great scientists, really put together a phase-in plan that made sense to us from a science standpoint and a healthcare standpoint. And then the state of Wisconsin has now adopted that as of yesterday with some modifications, actually all good for us in the state, really addressing specific Wisconsin needs. So basically taking the federal plan and making it Wisconsin appropriate. So the aspects that I think are really important for us as a community and us that are in business is you'll learn about 3 phases. There's the phase 1, and you can read about the things that are allowed, and it does relax what we're going through today. Not completely. Things like restaurants get to open up in a small fashion. We're going to prevent groups of 10 or more from gathering. Then you go into a phase 2 where colleges get to resume, and there's multiple other things. Retail's resuming a little bit more at that point. And in true Wisconsin tradition, you wait till phase 2 to get to the bar. And then you get phase 3 where things open up a lot more. Still some things concerning about, populations at risk, those that are in the hospital, those that are in nursing homes, and some restrictions around that as we continue to go forward. Everybody's asked me, what about those phases? And I said, the phases are really good goals, but you got to get there. And if you've ever played a board game, you sometimes have to roll a certain number to be able to start. So let's call this board game Chutes and Ladders, and we got to roll a 14 to get started. And it's really 14 days of showing improvement in the state and that the state has the capacity to handle what is coming in the future. So let's talk about the improvement. 14 days of showing that the signs and symptoms of upper respiratory infections are going down. Believe it or not, that's tracked in the state. That tracking has been going on for a long time when it comes to influenza. And so the 14 days of showing that is actually really important. The second thing is, and this is where I think there's a little bit of an interpretation issue, and if you read the state's order, it's really particular about this, is that we need to see the percentage of positive patients as a percentage of everybody being tested coming down. So it's not following the number of positives and wanting that number to come down, but the percentage of positives to the overall tested, so positives versus negatives, that trend line coming down. I just got a question on when the 14 days start. that's the question I would love an answer to too. And I think we're getting a lot more guidance from the state every day on that. But I think before that we can even start counting that 14 days, the governor and the secretary wanted to make sure that the infrastructure really be in place for that. So that's the benchmark on, the 14 days. And then it really comes down to testing. Does the state have the ability to test broadly to make sure, number one, that the 14 day is accurate with a broad level of testing? And number two, if there was a situation or a hotspot or whatever you want to call that, does the local healthcare and public health care, in partnership with the state, have the ability to respond, test aggressively, and isolate? So everybody talks about testing, and testing is hugely important. But what the state needs also is a positive test without tracing is nothing. And what that means is, so I got a positive test, if I just quarantine that person, I've not really done my job. We know how contagious COVID-19 is. So you need to be able to track or trace that exposure and make sure that we're quarantining those that this person's exposed. And if they're symptomatic, we're testing them. So what the governor pointed out is that we need a testing infrastructure, which Wisconsin has ramped up very significantly thanks to labs within the state of Wisconsin. Marshfield has a lab. They're going to run 10,000 tests. The Milwaukee Public Lab is running. The state lab is running. And a company called Exact Sciences that has made a colon cancer testing product kind of pivoted to a different kind of genetic testing and pivoted to helping the state with their COVID-19 testing. And they've actually been doing a lot of the COVID-19 testing for the state lab. What's unique about their process is they don't need the traditional nasopharyngeal swab, the really long swab that basically we call it the brain biopsy. That's not what we're doing. It just, I've heard that described as that. But this one, it's a smaller swab. It goes in the nose, goes into both nares, so the right and the left, lot less invasive, goes in a vial of saline, and then it can be tested. Those kits became publicly available last week to healthcare. I'm actually going to show you one right now. It's sitting on my desk. Not a whole lot in it to show you. Basically a Q-tip in a vial in a biohazard bag. You see that label, don't touch it. And what's in there is the opportunity for us to test at a much larger scale. So we've got the ability to test on a much larger scale, but we aren't at the point right now of testing patients without symptoms. This is really, the state has lowered the bar on who you can test, but you still have to have symptoms. But a lot of people were being quarantined for a long time with mild symptoms and not being tested. Now we can test them. So when you look at that as once again, going back to the 14 days, a percentage of positives to the whole, everybody we'd been testing at this point, we had a pretty good gut feeling that there's a good chance they're going to be positive. As you broaden that out, the number of positives versus the total pool should balance out a little bit better, and hopefully we'll see a trend down for 14 days. And once again, we don't know when that clock starts. So as the state looks at this, they want to make sure the infrastructure is in place and the tracing infrastructure is in place, the laboratory infrastructure is in place. And lastly, we got to make sure healthcare is ready. So you all have done us the largest favor of our careers by staying safe at home. You've allowed us not to become overwhelmed in Wisconsin, to be able to double our capacities if necessary, to make sure that we had PPE conservation strategies, to get physicians who aren't normally in the hospital trained up to be in the hospital, to get ready for that surge. You kept us below the line. You flattened the curve. And we would not have survived in healthcare, and society would have been in a lot of trouble if we had not done that. We did it before we had to do it, which means we did it at the right time, versus New York scrambling to do it after their health systems were overwhelmed. So on behalf of myself and Belen and Aurora and every single healthcare provider in the state of Wisconsin, really want to say thank you for the efforts that you did as a community to keep yourself safe, but actually keep us safe so we could create that capacity for you. So in the state of Wisconsin, we're looking at those components to getting back and really trying to get to that BBB plan, as it's been called, and really trying to open us back up. There's some questions on here that I want to pause real quick because somebody put that in. So April, I'll try to answer that. There's only testing for symptomatic patients right now. With the recent findings of COVID positive cases at a local meat facility, does that flag Green Bay Brown County as a hot spot? I would say that, not as a county that's a hot spot. Thank you, Chris. Great components that, everybody needs to partner together. So that was the healthcare perspective. Employers need to make sure that their work settings are ready to be opened up, that they've got the right protection for their employees, the right spacing for them. And then individuals staying safe at home, masking, washing your hands, those are all, things that we need to do. To go back to Jeannie's question about, are we a hotspot? I would say that, yeah, we're on the radar as a hotspot, even nationally, with the federal government coming in to help, but they were really restricted to employer settings, and we hope it stays that way. Now, we know there's going to be some community spread from that situation. It's just giving public health the time to get in there and do all the adequate tracing and quarantine, and hopefully people stay quarantined so that, hotspot doesn't grow into a hotter spot, and it doesn't flow into a much larger community spread problem. That's a concern, and hopefully we can contain that here. But it's really in partnership with public health, who's done a fantastic job. What do we predict will happen if we move into the next phase and then see a spike in positive cases? So, Jessica, it really depends on the spike. If it's like a hotspot type of spike where it's in a local area or a certain situation, say a prison or a nursing home, I would expect the state to be very aggressive at getting in there with public health and then asking for local healthcare support to address that. If we see the entire state growing exponentially, then I could see us, having as I said, chutes and ladders, having to take the chute back down a phase, restart the process and get everybody back in. So this could be a start-stop type situation if we don't do it well and if we rush into it. And that's the worst possible thing that can happen. You really want to get to that phase 3 and stay there, right? So to do that, you got to do the 3 phases really well, give it its time, make sure that it's working. So watching our numbers, and make sure that the infrastructure isn't being overtaxed, making sure the protective equipment is still there for healthcare, the testing capabilities continue to expand, giving ourselves time for vaccination development, giving ourselves time, to figure out antibody work and blood testing around there. So we want to make sure that it's working, that we don't have to take a step back. So, that's kind of the, what's going on from a state perspective and how the phases and the gating phase is the most important. And then, what's going on locally, the lay press will probably tell you as much as I know, is that we've got employers that have had situations where they've had positives, and then that's created more positives within the workspace. The public health department, the Brown County incident command people, and the CDC have all been involved in this situation, and they've asked for partnership with local healthcare systems. And Bellin stepped up first, and Aurora then us, to help them as we were called upon. So as we look forward to it, we hope that that's going to be contained quickly. There's a lot of work being done from a public health standpoint, from a scientific standpoint, to test and isolate and trace going on, and hopefully that can be contained. But we need a lot of education in the community around this. We need a lot of education, because one day it's ex-employer, the next day it can be yours. So there's a lot that can be learned, and we need to spread those learnings. Is May 26th a reasonable date, or do you feel it will extend given what we know today? So, May 26th kind of is a date that was thrown out last week and somewhat replaced by the phasing in program. So I'm not one that is at least considering this as any kind of fixed date. It's 14 days of monitoring, and then we go into phases. So this doesn't start on May 26th. I did not get that impression from the secretary or the governor at all. And like you said, we're looking for more information on that. But this was really a plan to open up Wisconsin in a phased manner like the federal government has asked for. So no date. And that's the difficult part. When somebody throws a date out there, you want to know why. And now we have more of a plan than a date. So other things that are being done, right now from a healthcare standpoint in the community, let's talk about treatments that are being done in the community, because all 3 health systems have made significant strides there. We've enrolled in trials to be able to use convalescent plasma. That's being used here today. Not today, but in the community. We've been using other medications under FDA advisement, such as TZZ, which kind of prevents that big storm of inflammatory response that really hurts a COVID patient. You hear about the clotting and all that. That's a medication that helps prevent that. So there are a lot of cutting edge things being done here within all the health systems at Green Bay for your benefit. So that was what was the good part of having this time to be able to get those here and to be able to give the time to our patients. You know, to kind of give you a comparison, an influenza patient spends about 3 days in a hospital on average. A COVID-19 patient spends anywhere from 10 to 20 days in a hospital. So they're significantly sicker, significantly more complicated to manage. And in the medications that we're using and everything we're doing is much more labor intensive. So 50 influenza patients versus 50 COVID patients are two different things. And that's why being able to have that social distancing, by able to stay safe at home, you bought healthcare time. You know, we've had patients be here for 3 weeks that unfortunately passed away. And having dealt with the family and a patient on this, I can tell you it is just extremely sad. I don't want to see it happen to any of you or any other family here. So we need that time. Not being able to be at the bedside, all of those issues, those are real, and that's happening in Green Bay. That's not a New York TV thing. That's happening in Green Bay, and unfortunately it's happened here, and hopefully we can prevent more of it by doing the right things. Got some questions here? People are talking to a second resurgence of cases in the 1908 Spanish flu. Are we concerned this could happen with COVID-19? It depends, Greta. I mean, there's a couple of factors into a second resurgence. You know, there's debate if you can get reinfected. There's few people that have stated maybe you can based on some Chinese studies. But, you know, really the CDC has come out and they really do feel it's a one and done with an asterisk. We're still waiting to see. So, you know, the resurgence, you know, could be due to reinfection. People are worried about that. Probably the biggest fear around resurgence is not doing a really good job at the phases and allowing the virus to overwhelm us. And then that's kind of almost like a vicious cycle of cascading, and then it blows up, and then we have a resurgence. So that's what's so important of making sure we gradually enter back into a normal hood, not just turn a switch on. How does our local medical community stay up to date on what seems new and ever changing? So Bill, I don't sleep. How's that? It's probably the best thing I can say. No, actually, you know, probably the neatest thing, and Chris, please step in because you said it the best. I mean, since the beginning of time when I moved here, you know, our health systems have competed, and I mean, we compete. And for the last 6 weeks, you know, the gloves are back on. We're coordinating every day except for Saturday and Sunday at 7 a.m. Everybody's contributing to that. And then our practicing physicians, and I still have a nursing home practice, we're literally reading every day, communicate with China, literally. There's a great Italian intensivist that's advised us. I talk to my friends in New York on a every other day basis. I've asked a fellow CEO, he's a really good friend of mine out there, if you had 2 weeks, what would you have done? And then tried to bring that here. So the level of sharing in healthcare today, I've never seen anything like it in my career. And it is impressive, and I hope it never goes away. I mean, the way the rapid progression of sharing for the common good and the common cause of healing the world, literally, has been so impressive. Nobody cares whose name's on the article. Nobody cares, you know, if they're getting paid for it or not for the research. They're just doing it. And it's been really neat to see as somebody's been in healthcare. There was a time where I had hair and it was dark when I was younger. Now I've been in it quite a few years. And as scary as the time we have, and I wish I was not living through this, I am just amazed at the sharing in the medical community, both locally, nationally, and worldwide. There are many conflicting messages about the stay-at-home order. The chamber sent out an email over the weekend not in support of the extension. Do you feel the same way? Is it just the specific date was selected? You know, I think, you know, I'll let Lori talk about the chamber, but even I would have said setting a date without an explanation created some personal frustration for me. Not official frustration, but personal frustration. I understood a little bit of the data behind it, but wanted a plan. And I was really happy with the pivot yesterday because that is a plan. So I'm not looking at this like May 26th, what do we do? I'm looking at this, let's prepare so we can get cases, you know, get testing ramped up, get tracing ramped up so we can show a 14-day decline so we can move into a phase and make sure our employers are ready, all of you, make sure our citizens are ready to understand that, so do a lot of education. I would buy into that more, but Lori, I don't want to unmute. I'm going to unmute. I don't know if I unmute you, but I'll let you talk on that.
Sure, I'm happy to share. It just really echoes what Dr. Ryan shared. Our concern was just throwing out a date. And certainly they had their rationale, but not sharing that, not sharing the why, and not reassuring that it's going to be with medical healthcare experts looking at regional data and trending and not having a plan. And so when you just have a date, there's no guide, there's no hope. And really hearing from our members, looking for where do we fit in, when do we move forward, how do we move forward, it just left a devastating feeling as opposed to an uplifting course of action. And so we felt strongly that there needs to be a plan, and now we have a framework to work within. And again, looking at data and working with the healthcare experts and looking at trends and looking at regionally, how do we continue moving in the right direction and run parallel with businesses about how do I prepare as we enter into phase one? You know, what are the CDC guidelines that I'm going to need? If I need PPE materials, what does that look like for my staff? And so it's about having, you know, healthcare or health and safety, obviously in the forefront, but running parallel as we look at the impact on our economy and our businesses. So I don't think they're mutually exclusive, and I don't think they can be treated separately. So I think on an earlier call, someone mentioned they need to coexist. That's exactly where we're at, and understanding that we need to move forward collectively and collaboratively and not siloed. So happy there's a framework out there, and hopefully we can continue to evolve each week as we look at data and trends and guidance from our local leaders in the healthcare industry. So happy to talk with anybody offline if you have any specific questions. So we're here for you. So thank you. I'll turn it back to Dr. Rai.
Thanks, Lori. And I think there's some questions, you know, and they're good questions, like, you know, how'd you come up with 14 days? Or, you know, why 3 phases? And those are great questions. I think, you know, when you look at 14 days, the average time from exposure to symptomatology is 5 days, but it can be as long as 14 days with the virus. So when you start to look for a gap or improvement, we've looked at things in 14-day blocks. And that's really with the data we know today. We may learn more about the virus and shrink or expand that over time. So understand that as we learn more, that's how the recommendations are put forward. We're looking at different models, and models are all flawed. They just are all flawed, but you have to find one that you can put a little bit of faith in and work off of that. But even a flawed model is a scientific model, so it is still science-based. And then, you know, as far as the phases go, they're really looking at the ability to control the situations and then slowly loosening up that control, but still being able to respond to trouble. So that's really kind of a basic, I guess, you know, public health type of formula that allow it to happen, but still be able to respond effectively. And that's testing and tracing, identifying, screening, all of that needs to have a component to it, so you don't get, you know, so you never have to go completely backward. And I think that's why things were phased out the way they were. But really, there was a lot of thought, you know, put into this by really good epidemiologists, really good infectious disease specialists, looking at the virus, looking at, you know, the time to first symptom, and looking at the data when they came up with those numbers. So they're not arbitrary, but they really do mean a lot to us in healthcare, because it's something that, number one, we can aim for, and number two, that we can educate on. And Chris, thanks for that message. I have to, she typed that, I had to respond to that. So how long do you think it'll take to boost the testing and tracing infrastructure? So Greg, that's an awesome question. I'd say the testing infrastructure, we have to see, you know, if Exact Sciences and the other labs can actually keep up with 80,000 tests a week. I think it's a little bit more than 80,000. I'm going to use 80,000 as a round number a week. And if it's true, from a healthcare standpoint, I think we are developing and we have that infrastructure to see the patients. If we get 80,000 of these distributed in the state, we can test 80,000 people a week. So I think, you know, as you go forward and start looking at that, I'd say the testing infrastructure is on the starting line right now, and now we have to prove it. And we're going to start testing a lot more people and making sure we can keep that cadence up and making sure that the manufacturers are keeping up with us. So I'd say give that, you know, a few days here to really pan itself out. There are a lot of things that are missing in the plan right now that need to be done, such as right now when we're doing the testing, we're using paper. Paper does not exist in healthcare very often anymore. We use an electronic medical record, so they're trying to build an interface to make it easier. So we won't get up to 80,000 a week this week or even next week. But if we start to see that increasing amount and knowing that we're going to get there, I think that leaves some confidence and ready to get out of the gate. As far as tracing goes, they have to hire 1,000 people. I think that there is the ability to do that in the state right now. There are people who are furloughed. There's people who it's the tracing experience. What we need is we need more bilingual, multilingual people to help with that because we got to trace everybody. And we need people that, have a little bit of background in healthcare and a little bit of background in dealing with people, but a lot of it's telephone work. So, I think it's not going to be hard to find a labor force for that 1,000. And knowing what the good work you'll be doing for society, I think Governor Evers will fill that pretty quickly. Hopefully that answers your question, Greg. Is it more rolling 14 days, more like we see a decline in cases and testing is up and we start the 14 days and we jump, so we have to wait and start over? I think it's more of a trend line than rolling because you're going to always have peaks. It's just what's the actual trend line. Even when you looked at some of the best scientific models, like the University of Washington one, the IHME one that, I've quoted a lot, and so is the national federal government, even when they start talking about the death rate, they looked at, they had peaks on the graph. They were really looking at trend lines when they were making their predictions, because we know in healthcare, you're always going to have a minor, 10 more cases today, but that doesn't mean you have to throw everything out and start over. I think it's really about the trend, but we'll get more guidance from the state on that. So that was a really good question. So Brenda, what are we going to do about elective procedures? So I think that the governor really left it out on purpose, primarily because the state of Wisconsin shut down electives probably sooner than most. And we've left our citizens needing healthcare and wanting us to ramp up. The one thing that we've done in Wisconsin is to really modify healthcare institutions to become safer than they've ever been before. Masking everybody, the screenings that we're doing, knowing that there is a large body of patients that are needing our care. For example, if you had a ureteral stent put in, we left it in for 30 days longer than we should have, but we knew it wasn't going to cause a whole lot of harm if we waited, but we can't wait a whole lot longer to get that out. People are in pain, needing their spine surgeries, their knee surgeries done. There are a lot of things that need to be done. So, we were waiting for guidance from our national bodies on that. We got that from the American College of Surgeons. And then Seema Verma, the director of CMS, kind of gave us somewhat the go-ahead on how you're able to do that. So now we have a playbook, and now we internally have to make that happen. We have to see a decline in the cases we're seeing in treating, and then we have to ramp up from a personal protective equipment standpoint, making sure we have enough and making sure we've got a good testing philosophy so people are coming into the hospital safe and their procedures are safe. Every health system is kind of shared there. Once again, great sharing. Here, this is what I'm doing for pre-ops. This is what I'm doing for pre-ops. We're all aiming to get going here soon. I don't know if, I think we all have a different date because of our infrastructures are slightly different, but all within the same ballpark of a couple weeks to 3 weeks, throughout the state. Now, a lot of things can set that back, so none of that's written in stone, but that's what we're all trying to aim for. What's going on in Brown County could easily set that back. If it gets out of control and our hospitals are flooded with patients, then that could be set back. But one of our biggest priorities right now is for healthcare to get back to work, because our patients need us, the community needs us, and we realize this. So for example, there's an article that's out that 1/3, our volume of STEMIs, which is a ST elevation myocardial infarction, better known as a heart attack. People coming in, it's a third down. Now, somehow I don't think stress has gone down. I've seen what you all are eating during quarantine, so I don't think anybody's cholesterol level is going down. What's happening is everybody's ignoring their symptoms because they're scared to come to the hospital. And the number of dead upon arrival calls that the Green Bay Fire is dealing with right now is significantly higher. And people are wanting to leave against medical advice because they don't want to come to the hospital. So I'll just start to describe our hospital, and I know Chris could do that as well. And Chris, feel free to chime in, please. But understand this, with our universal masking policies, with our screening policies, and us seeing all of our COVID patients outside of the hospital. So for example, all of our testing is in drive-up testing. Bellin has this awesome respiratory clinic, and then we actually copied theirs and opened one up in Schwabenheim. All of that was done to keep COVID outside of your hospitals. So we have a minor number of patients that are sick, but they're in COVID units, not in the general area. In the emergency department, they come through the garage, not even the main waiting room, to be seen if they need to be seen. one of the cleanest and safest places to be right now in all of Brown County is the emergency room. It's a lot cleaner than, say, a grocery store today. When you have community spread, everybody's masked. So we need to be able to communicate that to the public so they're not delaying their care. There's cases of appendicitis that, would have been a 15-minute surgery with an incision this big, and now, it's ruptured and we're having to open up the entire abdomen and do major bowel surgery because people aren't coming in. And that is concerning us in healthcare significantly. So, when I talked to Secretary Palm, and Chris has had a conversation with her as well, that's a state health concern. Believe it or not, us not doing what our elective cases is actually a public health concern right now. And that goes beyond electives. It's convincing everybody to come to the emergency department. So we need to make sure we're educating around that. All right, I'm trying to figure out where I left off. Yep, there it is. Is the 14-day trend needed statewide, or is there any discussion about county or county discussion? So Kristen, I'm not a politician, and I don't know what that argument's going to be. The federal government regulations said within a state you could look at it county by county, but understand that our counties are not as demarcated as they are in other states. I mean, we have such overlap here that it's hard to say that Brown County can do one thing and Manitowoc County and Door County can do another. Each one of us can probably run an errand in one of those counties today. So if it's done regionally, we really have to understand that that's more for, I think, almost placating a voice rather than good science around that, knowing that how easy it is to commute within our state. We're not California. There isn't like a northern half and a southern half that's a day's worth of travel away. So, I worry about people wanting to do this county by county or region by region, not understanding that if one area opened up and had a hotspot, it doesn't mean it's not going to overflow into you. And that's really important to explain. So Renee, yes, there is a gate to get into phase 1, phase 2, and phase 3. So to get through that gate, there is a 14-day period of improvement that needs to be seen. And if we don't see the improvement before May 26th, so once again, I think the May 26th date is being thrown out there, but I think everybody needs to look at the plan. So that plan, it could take months if we keep having major cases and breakouts, and we should be containing in that time period. So the timeline is not a date. It's really looking at a trend line over a certain number of days. Let's get back to testing. If we're tested and not infected and venture out, do we need to be tested again? Testing is not a one and done. Great question, actually. So that's one of the reasons that we're worried about testing people without symptoms or asymptomatic testing is we don't want to give everybody a false sense of security. When this is negative, all it means is it's negative for the time they put the stick in my nose. Sorry for that reference, but that's all it's negative for. By the time I leave my office, I technically could be re-exposed even though I'm wearing a mask. So we don't want to give this false sense of security on a negative test. If it's positive, that's the really important part. Because if it's positive, we can do contact tracing, we can quarantine, and we can prevent spread. So this is about a trending down on the percentage of positives, which is good. That only happens if we have enough positives that we can trace and quarantine. Hopefully that makes sense. So the antibody test, April, it does exist. Some of it, we're just working on the accuracy of it and then how to use it. Because we don't know how long that protection actually lasts. I don't know if you're going to produce that what's called an IgG antibody. That's the antibody that fights the disease that you produce on your own. I don't know if that's going to last in you for 3 months, 6 months, 9 months, or lifelong. And that's the research we're doing now. So we don't want to give everybody a false sense of security. We actually have been toying around with what we call these lateral flow antibody kits. Think of it as a pregnancy kit. We put a drop of blood on, it rolls down the selector, and a couple lines pop up, and we'll know if you have immunity or not. So we're trying to validate that to make sure they're accurate. There's a company that we bought a bunch from just so our labs would get some experience with it. We're also looking at other labs that actually can do a blood draw, so a real draw. I'm pointing to my arm, my elbow right now, where we draw your blood from, and getting a vial of it, and then actually seeing not if you have an antibody or not, but how many antibodies you have. There's a lab that's going to start doing that for us here in the next day or two. But once again, how are we going to use that data and what are we going to use it for? That's for healthcare as in general to work with public health to get a good plan for. So that involves the CDC, the IDSA, the American College of Physicians, all of us to be on the same page on how we're going to use that data. And this isn't like months down the line. We're working every day on this issue right now. So hopefully that made sense. April, a lot more to come on that. It's a news report that individuals in Korea and Japan who've had COVID tested positive, again, recovering. So that's a tricky question, Carrie, because these have been really anecdotal reports. Reinfection is something that has not been proven. And some people say that the virus actually can stay in the body much longer and you're infected much longer, and that's not actually a new infection. And they're kind of doubting the true negative test at the end of it and then secondary positive. So there's some debates about those cases, so I wouldn't put a whole lot into that till we've studied it a lot more in the United States. So right now, and then Dr. Fauci has said this publicly, and I like to quote him because he's a heck of a lot smarter than me, he does believe it's a one and done right now, based on what we understand of the genetic makeup of this virus. Chris, thanks for clarifying, and I'll read this out loud for people who are on the phone. So Bellin has created separate place for their COVID and their non-COVID patients. Their outpatient West Superior Clinic is for respiratory symptoms. Their other clinics are available to see patients for other needs, and they're trying to do as much by telephone and video visit, but also see patients for face-to-face visits as needed in their clinics. Their surgeries are being triaged upon a determination if it's safe to wait. And they have a surgery center in Marinette that's starting to see a few elective surgical cases using very strict protocol. They're working on their plan, providing more elective cases to meet the need, because we're seeing more patients presenting to our ER with exacerbated symptoms like I was describing. And for surgery, that's telling us that we need to provide more access for non-COVID symptomatic patients. So thanks, Chris. I mean, it kind of mirrors what we're doing. And, Bellin's really done a great job setting an example for the community with the respiratory clinic. And we all want to get there. And we all want to make sure that people are getting the care they need. Phase 3 calls for a maximum on gatherings after a max of 50 people in phase 2. What are your thoughts on returning to public events as normal for some of the large community events, thousands of people that happen in city, state, and county? So Chelsea, I wish I had a good answer to that. I think that's what phase 3 is about. I think living in this town, but Chris is not going to a Packer game until there is a vaccine or other treatment available. I think she said large gatherings. I put Packer game in there for her. But really, I'm with Chris. It is going to be a couple things that need to be looked at. You can look at it from a vaccine standpoint, or as we learn more about the antibodies and learn more about herd immunity, and we test significant patients, swaths of the population to look for immunity, that would be the alternative to vaccines when it comes to those really large gatherings. So I don't know how, from an epidemiologic standpoint, you do that quickly. But I think everybody's looking for that answer right now. What employer risks when their employees attend rallies and violate the social distancing? I don't really know how to answer that. I mean, I know recently it's been highlighted in healthcare, but I think it's talking to your employees. If you have universal masking and symptom checking, you're mitigating your risk a little, but that's all you can do. You can't control people's behavior when they leave the building, but you got to be able to do symptom checking, maybe even temperature checking. Masking would help to prevent that from coming back in the workplace. How long can a carrier be carrying the virus without manifesting symptoms? Patrick, I think that's the million-dollar question right now. The CDC would say 14 days, but we have no proof of that. We know the normal virus life cycle, and that's why we're going on 14 days, and you hear that number a lot. But somehow I don't think the virus, which is a very small piece of genetic material, knows a lot about the Gregorian calendar and knows what 14 days means. So I think that's what we've observed, but it's not something that's written in stone by any means. Once a vaccine is approved and ready, how quickly will it be available to the community? How quickly we start to see the impact of herd immunity? So, once again, It's hard to know that. I think it's best to look at vaccines as 12 and 18-month plans, not 6-month plans. There's some talk out there in the news, and that's the lay press. Just, I've never seen it come in 6 months, so I can only go with our experience. It takes a lot of testing. And then you need to immunize a lot of people to get herd immunity. We have to start showing that 70, 80% to really, get a definition of herd immunity around. So that means, mass immunizations. And in the community and the immunization world today, I'm not sure how likely that's going to be. So we're going to have to look through that through a lot of different lenses. I want to make sure I'm keeping us on time too, Lori, so cut me off at any point. And looking for any more questions. So other things like how long does the COVID-19 stay on hard surfaces versus soft? There's a lot of research going on there right now. It depends on the hard surface. Some would say 3 hours, some would say 3 days. The CDC has not actually come out and said this many minutes per surface, but they have been doing some research on it. So my number one recommendation is treat every surface like it has it on it. Make sure you're washing your hands regularly before you touch your mouth or your nose. So I'm going to read this from Brenda so those on the phone can hear it too. You mentioned that the state had loosened up regulations on who could be tested. Yep. One of the biggest frustrations has been individuals who had pretty severe symptoms for multiple days and told not to come in and could not be tested. You're right. How quickly will the changes be effective? As soon as we can get good communication and our plans in place, so a day or two. I'd like to be able to tell friends that testing is more available, whereas it wasn't before. Right now, if you were to come in, but we would really suggest you use our virtual platforms or go to one of the respiratory clinics. You will likely get tested with symptoms, not having to have the risk factors. We have not broadly communicated that internally because we want to make sure that we have all the operations set up for it. But if you come in and we follow the state guidelines, you're going to get a test. Well, I just got a question. Thank you, Dr. I still stay to jump around on Saturdays at 3:00 p.m. You'll notice that behind me, there's no Badger helmets, but there is a Wolverine one. So I will never endorse what you all do at 3:00 on Saturdays. Ain't going to happen. Not going to say it, April. And that's why I'm calling it the bounce back plan. I'm not even using that other word in there. But I actually really do enjoy that tradition. Although this year, being at the Michigan game, you could imagine I just sat down during that as my Badger fan wife was jumping all around me. How about an isolation tailgate on Sunday afternoon? Brad, only for a Lions game. You really are picking on me. The CVB is going at me today. Are there any set rules for Brown County businesses for prevention, things the Department of Health would want to see or require? Alyssa, that would really come from, I'm going to ignore you, Josh. I'm not going to even say that word. Are there any set rules? So that really has to come from public health. And I think that what they're really doing is trying to get consistency around the state. So if one county had rules that a next county didn't, I think that is how things could fall apart pretty easily. So the rules are really statewide right now, and they are about social distancing and how to set up your businesses appropriately. There's some good guidance, and I think more will come out given the governor's recommendations. We have to give the government time to create all of that. This has been fast moving, but I would see that more as state recommendations. But once again, I don't even know the politics of that. But I think consistency would be better than individual decision making. And Josh, I'm not definitely not going to say that. Is the chamber offering meetings to discuss best practices for employers? So Patrick, I'll leave that up to Lori. I think we could. I think all the health systems could team up to help the chamber with that. We each have occupational medicine departments that can talk through that. I know I did a talk earlier today, and we're happy to share our screening questions with you. The cleaning, of your work surfaces and all that. The CDC has great guidance on that. There's no need to reinvent that playbook. CDC.gov has great advice for employers on cleaning your workplaces, social distancing when it can't be done, how to mask. Those are really good things for best practices for employers that, I can make sure, and I know my Bellin colleagues and Aurora colleagues can make sure the chamber has access to all of that.
And we're happy to share that. I know we've brought in several different industry sector roundtables to share best practices and thoughts that they had now, but certainly having specific guidelines from the health industry would be beneficial. And I know Mickey will take the lead with that. So watch for more to come as we can pull that information together, make that readily available, not only on our website, but have some virtual webinars around that. We're really happy to fill that in. So thank you.
So what is it? All right. Paul just has a comment there. Paul has a comment for you, Lori, on chamber. Can you help us better understand the change of tune on wearing masks? Why have some, but not all states required it now? You know, Kristen, I can't answer the question on what politicians are thinking. You know, I know what the CDC and the Surgeon General were thinking. Same thing I was thinking is that we were trying to prevent asymptomatic spread when we recommended them. And while asymptomatic spread is out there and we can't maintain social distancing in certain environments, a mask makes sense. But once again, it's a republic. Every state's going to make their own decisions. Just take on visiting relatives by having the visitors in the driveway and talking through the window more like 12 feet. You know, Greta, I think that's awesome. I think our people need social interaction. Just make sure it's safe, maintain that distance. But, you know, some, you know, may know, you know, with me and my kids even, you know, having to do that for a time period was my reality as well. Make it safe, but make it social. Physical distancing does not mean it has to be social isolation, and we have to find ways to do that. Yeah, and Chris, it doesn't. It was kind of interesting that that the BBB didn't yet. The first or the second or the third order actually didn't mention masks, but mentioned it was okay for hobby shops to open up so you can get cloth to make masks. So kind of trying to figure out where that messaging was on that. Will it be obvious when a 14-day decline has started? Is there a public tracker we can follow? You know, Kimberly, you know, I think the percentage number you'd have to manually calculate based on the DHS website, but I'm curious if they're going to pivot to start to show that now, and hopefully we'll see that in a day or two. So I don't have an answer on that one. So procedure when an employer finds out an employee has COVID to call the health department and follow their lead. Is there anything else we should be doing if and when this recurs? So a positive COVID is automatically reported to the health department and they're doing the contact tracing. You may actually get a call from them before you know, because if it was in contact in your area. If you need advice from the health department on what you should do because you have a positive patient, feel free to call the health department for that. But we actually have to call every positive to the health department. Thank you, Chris. It does say that strongly considered.
So I know for the last 45 minutes, we've really had an opportunity to just bombard both Dr. Rai and Chris with questions. And I just really want to close down here and just share our level of appreciation for the leadership in the healthcare systems that we have, your level of collaboration, the fact that you, all of you are a phone call away, and just really amazed by your level of communication and sharing and collaboration. And certainly an honor to have both of you on the call today. And any way that we can support you, I think it's been a one-way conversation. With all my meetings today, it's really about what are you doing for us? How can we move forward? And looking for direction. And I just want to reassure you that we certainly understand that your businesses as well, and you have employees, and this has not been an easy road for all of you either. So on behalf of the chamber and their membership, we're here for you and want to know how we can pull together and advocate on your behalf. And certainly the call we had with our legislators today, there's some takeaways for me that we can do, but just making sure that you reach out and make sure that you have a call to the community, because you've had our backs and we want to make sure we have yours.
Well, you know, like I began this conversation, the entire community had our back. You stayed home. And, you know, for myself and my partners and every other physician, nurse, respiratory therapist, janitor, administrator, phlebotomist, you know, we really appreciate that. That would have been impossible to accomplish. You know, I have friends in New York and Chicago, Detroit. I did a Zoom call with all my cousins, and I'm not much to do the cousin thing. Some I hadn't seen for 40 years, but it's kind of a family thing. I got like half a family of doctors, and they're practicing in New York, Massachusetts, Chicago, Detroit, and knowing what their communities did later and the position they're in versus our community, without a single case, without even a hint of COVID being here, you stayed safe at home. And I can't tell you how much we appreciate that, because without you, we would have been overwhelmed. We're ready now. If you asked me 6 weeks ago, probably never more scared in my life. So we really do appreciate what you've all done for us. And now that we are turning our healthcare machine back on, probably the biggest message you can share with everybody is don't delay your care. It's probably the cleanest and safest environment you'll ever go to. And we need to get that message out. So if there's any message we can get out there, is that your healthcare provider is open for you when you need us, 24/7, all of us here in town. That's a combined message.
We got it. So thank you so much. Thank you, Dr. Rai. Thank you, Chris. And thank you, everybody, for taking time to join us today. And just remember, the Greater Green Bay Chamber is here for all of you, and we'd love to hear from you. So take care.